Welcome to the Medcurity podcast. My name is Mel, and on this episode, I have two guests with me, Naseem and Margaret. Both have a strong background in building a foundation for HIPAA from the ground up. And during this episode, we talk about privacy, good digital hygiene, AI, and a lot more. Naseem, do you want to share a little bit about you?
Sure. Hi, everyone. My name is Naseem Dastgerdi. I'm located in Huntington Beach, California. I have 10 years experience in the healthcare field and currently holding position as Executive Healthcare Compliance Director for an offshore BPO located in Mexico. And I'm happy to be here.
And my name is
Margaret?
Margaret Karatzas. I'm the business analyst over at Medcurity. I conduct security risk assessments. I also assist in policy builds. Happy to be here. Yeah, I'm actually located in Prattville, Alabama, but I am originally from Washington State. So yeah.
Before we get into the more, I guess, deep dive topics, when we think about privacy and security and just kind of your I can't talk, day-to-day life. So what kind of like privacy and security habits do you have of your own, just kind of like protecting yourself or your security and privacy?
I have password specific for all of my platforms digitally and in my phone as well. I don't save a space in my phone that has all the passwords, which typically I see with notes, kind of the way it is on desktops. I kind of just have learned to memorize things or place them somewhere that I know is not accessible digitally. And whenever I'm in public, I try not to use my credit card in a place where I know it's not going to be legit, especially when traveling internationally. I always call and put the travel alert on all the countries that I go into. I check the transactions when I come back. And then when it comes to work-related devices and whatnot, everything's secured. And I make sure that I walk away and I turn off cameras, put on passwords, always close my laptop, never really discuss anything in a public space such as Starbucks. And airports, there's a lot of people around listening and wanting to kind of be eyes and ears for other people. You never know who you're in front of. So I'm very cautious of that publicly at all times.
Right. Yep. My sister, she had gone on two different trips, and each time she was at the airport, right before she landed at her destination, she figured out that her credit card had been compromised, and she had talked to her bank, and they said that, to be mindful of people standing really close. I guess somebody at both
Yes.
two different times had managed to get her
Yes.
credit card number just by standing behind her in line.
Yeah.
Yeah. What about you, Margaret? What do you kind of think about
Yeah,
in your day
yeah.
to day?
So yeah, just being hyper vigilant. So, when you're cruising the net, whether it be for work or personal, just don't click on things that you don't know where they're from. If you get some random emails, you're getting random texts on your phone, just don't open things and links if you don't know their origination. And I think what's really interesting is the phone calls that are now coming through. Because I know before we were dealing with a lot of emails, we were dealing with texts when it comes to phishing scams, hackers. But now the phone calls have also started coming through. So just being very careful on what you're answering and what you're committing to. Your credit card, like you said, when you're traveling and even at gas stations. And I think we're so used to just doing the tap and just tapping here and there and here and there. I think the readers, when it comes to being the credit card at the gas stations, they're getting better and better. And so be careful when you are just tapping at the gas station and tapping here and there because you can be giving away your chip code as well.
Good point.
A friend of mine who works in threat intelligence. He told me that when he stays in hotels, he actually puts his devices in the microwave. It
Oh,
sounds crazy, but he's like,
okay.
oh, it's like a Faraday cage for him essentially. And he goes to a lot of cyber conferences, and he was telling me, he's like, well, if you think about it, it's not only going to be people who are like ethical hackers and going there for the right reasons. There's also going to be potentially like threat actors there as well. So it's like, oh, okay, that's good to keep in mind. But yeah,
Mhm.
it is easy to kind of like let your guard down when you're traveling, just because you're on vacation. I guess it's like that. I guess it depends on where you go, but yeah. And as far as like the AI tools and things like that, like what's your go-to?
That's very new in our facility, and since we're contracted with so many different types of facilities, our expectation is different. We have a lot of pilot programs and a lot of things that we're working on. But right now, within our organization, we're heavy on Gemini and Otter. Those are the two that have really worked for us, but they're kind of it's under pilot with different options and things going on in our organization currently. Mhm.
Yeah, I love Gemini. Gemini's my favorite.
Okay.
What about you, Margaret? Are you Gemini, ChatGPT, or what do you use?
Yeah, for now it's just been ChatGPT, not the free version, obviously. But I did have a question for Naseem. When it comes to AI and any kind of tools going forward, what have you guys been exploring as far as monitoring tools? So for workforce, for healthcare workforce.
Yeah, great question. So we have a business intelligence department, and that individual that works the entire operation for all of our campaigns has a back end system. To be quite honest, I'm not involved heavily in it. I can be if I want to be in the future, but as of right now, he has data for everything and anything on all the calls, all the systems with the EMRs and EHRs. He has tools that he can go down to the last minute as to why things have happened and what was said. And then he gathers all that data. We have quarterly business reviews with all of our clients. So 4 times a year, and we review all of that data. And so the AI component of it is now added in. And some of the clients are asking for us to be working with their platforms into ours. And so that's kind of a newly developed side of the organization. And it's so accurate and so amazing how he's able to gather so much data from the phone systems and the agents that are putting in all the information and then coming on the other end. Because the biggest challenge in the agent work for all these clients is accuracy and the clinical information that they might not have the intellectual background on, but they need accuracy, right? They are English and Spanish speaking. However, the clinicians and the physicians on the US side always want accuracy. Why? Because of the payers. You know, without the payers getting accurate medical records, they're not going to be able to have a good agent on the other side of the call. So we're constantly working on ways to basically streamline processes and then having those on the back end collected with data and AI. So it'll be interesting to see what the next 6 months of our operations look like and how much data we've collected because it's such a pilot that started in 2025.
Thinking of like just your experience and all the time that you've spent, consulting and working in the healthcare privacy security space, how do you approach building a culture of compliance and security from the ground up? If you go to a client for the first time, like where do you start, Naseem?
So I go in and I ask them for their business operations manual. I check out the organizational structure and the org chart, and I determine what the roles and responsibilities and job descriptions are for from the top all the way to the bottom, and get a better understanding of what the workflow processes are operationally. And then I go to the security and risk side of it in IT. And if there's a CIO, if there's a director, who these roles are and how often they meet, what their processes are, if there's third parties that are contracted within, and then on the outside of it, what entities are they obligated to submit audits for? How often do those happen? And then the policies and procedures for the entire operation versus the policies and procedures that are for security and risk, and compared to what the obligations are for the external entities. The master service agreements are a major one to see which client is requesting what. With offshore BPO, it's been really interesting because every facility is so unique to itself, but essentially the job is the same, right? But when a consulting role, you have a project that you're given, they come in and they say, okay, we're under audit with a carrier. What do we do to fix this? And so I go in and I look at the billing department, I look at the clinical charts, I meet with the clinical directors, I look at the higher ups in that division and ask them what their day-to-day challenges are. I look at records that go back, however many years based on the EOBs and the different types of things that they've received internally. But it all has an organizational structure that's based on the project, based on the facility, because it's so different with each client. But I'm noticing that the EMR systems from 2015, when I first started, to current, have so much more user friendliness and so much more optimization abilities that can be controlled internally, but nobody really knows how, or they haven't put the time to train and really get their hands and feet wet every single day because the budget for that role is not necessarily there with the organizations, right? So that's the biggest challenge I see. I mean, they think that they should recreate the wheel over and over and over again when they shouldn't. It's all there. It's just a matter of really researching and setting up appointments with the people at these companies to be able to get trained adequately, even when you're at a director level, even when you're at a CEO, CFO level, because they're the ones that are essentially paying for it and wanting to see the results, and they don't even know half of what's happening on the inside, right? I find that to be really fascinating when I go in, when a CEO knows of the company, but doesn't know what the company does and how they do it. They just fund it, right? Okay, we're taking care of this way. And that's always a really interesting conversation to have with them is like, how much of this do you know? And it feels like they have other people working for them all the time. So, they need someone as a consultant, as an assistant, as a director to really help them bring what the reality is for risk and mitigating that risk continuously all the time. So those are some of the things that I've really observed throughout the years. And on the technology side, because it's advanced so much. I remember when I got my master's in health informatics in 2019, COVID happened and it came to life. And after it came to life, I realized how strong technology can truly be, and how much healthcare is so fragile in that space with the details that are involved, because of the amount of payers and the demand for what insurance really is in the United States. And so, you know, as I sit here today, 10 years into this, I really, really um, feel like our work is so fragile and our work is so, so critical and important for the operation to truly be successful, with partnering with companies and working together. I always tell the team, hold hands instead of throwing rocks when it comes to compliance, because, I'm here to help you, help me, help us, and I always repeat that when I'm in meetings, because essentially we're here as a team to make this work and be successful.
Margaret, what are your thoughts on that? Because you also go on site with clients and
Mhm.
different org sizes, and I feel like depending on who you talk to, they're going to have different things that they're focused on or more stressed about. I'm curious, like as far as how the stressors have changed. Like maybe they were worried about ransomware 2 years ago, and now they're worried about the shadow AI tools, or maybe there's the mergers and acquisitions. Like as far as going on site, Margaret, what about your experience? Do you want to share a little bit about you know
Absolutely. Yeah, yeah. So when it comes to Medcurity, we really do have a large array of clients. We have, tiny private practice where, it's a husband and wife, and the husband is a physician and the wife, manages the
Mhm.
front end of the office. And we have all the way up to very large hospitals. So every client is different, and every approach is specific to each client. We go in and we look over all of their policies, all of their documentation. That's really the starting point. And then after that, obviously, we go through the Medcurity dashboard and we work through our security risk assessment. We really try to find vulnerabilities that we can pinpoint and help with. That's first and foremost. You want to have a good foundation when it comes to compliance, and you want to know the pain points, which ones we need to address first. And it's broken apart into obviously privacy and facilities and all the different safeguards and administrative safeguards that we need to tackle. And so again, that's against the across the board for all of the clients. But then, like you said, when it comes to the smaller ones, they have different things they worry about, and then the larger clients have different things they worry about. So then it's really tailored to that approach after that. And then we have the interviews, and that's really where when you get face to face with the clients and you're talking about the procedures that are going along with their policies, and I think Naseem touched on this one where you have leadership and they don't really know kind of what's going on in the background. They
Mhm.
have their different departments and department heads, and they think, they got it. they know what's going on. But it
Mm-hmm.
really does need to be a cohesive approach. Everybody needs to be on the same page, and we need to know the pain points of each organization going forward and how to address those.
So out of all the clients, like what's like a common thread as far as questions go, or like the things that your clients are most surprised to hear
Sure.
whenever they're asking your advice and things like
Yep,
that?
yep. And I think Naseem touched on this one as well. Auditing and how to touch in all the auditing when it comes to the EHRs, the different EHRs. And Naseem said maybe they think it's very complicated and they try to reinvent the wheel. Technology, for the most part, is within a lot of the EHRs, the electronic health record systems. You just need to know how to utilize it properly and how to pull out the audits that are required and need to be documented thoroughly. That would be number one. That's what I see most of.
I think for myself, with FQs, federally qualified healthcare facilities, because they sit on boards and everything is approved and budgeted every month, it's challenging for them to see progression of a goal be completed within a certain time frame. And so they in the compliance department or in the QA department that I've worked in myself personally in Orange County, I've always seen that part be the lowest hanging fruit and the least priority because changes don't happen that easily, right? And then when you have an electronic medical record system that's older because it's cheaper for their operation to enforce and implement, they get stuck and they keep trying to fix it and fix it and fix it. And I keep thinking to myself, like, why not just put a little bit more money there to have a better modern system versus a dinosaur one? And then we won't have all these problems, especially when it comes to auditing, especially when it comes to clinical charts and notes. And then you have the physicians on the other side complaining that this doesn't work and that doesn't work. Well, that's because it was an operational decision from the top that really benefited what is there for their budget, more or less. And then you see other side of that where nothing is touched until an audit hits. And that piece is very much so reactive instead of proactive. And it drives me crazy because I think to myself, you guys had so much time to fix this and you knew that it was coming, but you just didn't want to put attention to it. I used to work really closely with a billing director there, and she would always tell me, and she'd pull me aside from time to time, Naseem, I know it's coming. I know an audit's going to come out of this. And lo and behold, after I left the organization, it happened. And, that's the piece where I always would tell her, you need to go to your report to and complain about it and bring attention to it. And, that challenge in an FQ space is always seeming to be there. And then also, with other companies, as far as the back end interface and setup on the implementation side, and really having a structure in place, kind of the way that security risk assessments work with Medcurity, there has to be a foundation to it, right? And that foundation needs to be built prior to the system being implemented and the users being put into it. A lot of organizations fail to do that properly. And then you have so many clinicians and agents, and the whole operation is a disaster for a good amount of time until all of it gets organized. So I think really building the foundation of the EMR and EHR from the ground up before implementation is critical for success for when it comes to audits as well, because you can just pull reports and easily provide them to your auditor or to your external entity for reporting and whatnot. I used to work with an organization that it was a homegrown system and it was specific. It became a very well-known company, and it went, viral with all of these rehabs. And all of these rehabs are now contracted in that company for their EMR system. But the EMR system got to a place where it needed billing put into it. And so I really learned the billing side of how to put in the charts and how to put in, all the different levels of care and so on and so forth. And then, when an audit would come through internally, it was so easy to say, hey, clinician, Jack versus Joe, you're not doing so great. What are we going to do to fix this? And I wonder what that organization looks like today, because that was 10 years ago for me. And it's just, having more understanding and in more depth of the back end of so many different processes, the way that it is with Medcurity makes the experience so much easier, faster, and accurate when you're training on the front end to actually have a successful security risk assessment come through. And that's really, truly what I've learned with Medcurity in the past 2 years, going through 3 of them now. It's been such a rewarding experience for me.
I mean, training and and just the different, like about 10 years ago or so, I was working in healthcare, and we had 4 different systems. At one point we had Charm, we had Codonics, there was, what was the other one? I mean, and there's like, in general, there's the similarities, they can do the same core things, but then the UI and everything is in a different way. And I can imagine that anytime there's a big change in the company, or new employees joining, how stressful it is for IT and everyone having to deal with the training and all that. And of course the providers or the clinicians have a different, they're focused on the patients. They're not really the last thing they
Exactly.
want is a big change or overhaul in how things are going to be handled.
Yeah, a
What are your
major EMR that most of our facilities use is Epic. And it's interesting how much each facility has its own way of being frustrated with it. And I always tell them, why don't you guys just set up a call with your representative to get more training on it? And that culture, it seems to be so challenging to enforce and really want them to get them motivated to have that interaction with the actual company versus internally trying to recreate things. I think Epic has been one of the more challenging ones, instead of eClinicalWorks and Cerner and some of the other ones that we also use as well.
what are your thoughts on that, Margaret?
As far as the ease of auditing, if you just know how to use the tool correctly, is that what? Yeah, I think Naseem nailed it. Yeah, I mean, to really talk to each organization and say, you have vendors, they want to help you with their product. You just need to get on the phone with them. They will train you. They will make it easier. The technology is there. You just need to utilize it properly. Yeah. They don't need to figure it out on their own. They don't, like Naseem said, try and reinvent a system within a system that already exists. You just need to be trained on it properly and utilize it the way it's meant to be utilized.
So if you were meeting with a client, say a new one, or like, I guess for the first time, and you're going through their process and helping them with their SRA, like what are the, say, like 1 or 2 big tips that you've given them? We're like, oh, well, that's awesome. I didn't even think of that.
I think for me, having firsthand experience with the security risk assessment, with this company versus with any other one that I've worked with, um, is really knowing who the key players are for the organization and the structure of the documents and the appendix and all the different things that lead up to the security risk assessment and the maintaining of the data 365, 24/7. I think that part needs training and a lot of oversight, because essentially to get to the SRA, those informations that are in the appendix will determine the outcome of the results, right? And then also who's responsible for what, quarter by quarter by quarter, and having check-in meetings with each department, which is what I do currently. And, from facilities to operations to HR to IT to compliance, and, really making sure that everyone understands what the roles and the expectations of what they're doing for this from the onset all the way to Q4. At this point, I've kind of learned, Q1, you're gathering, you're tracking, you're organizing. Q2, you're checking up, you're meeting in. Q3, same thing, check in, meet up, and then start to gather and collect all, 8 months through. And then Q4, it's kind of like a mock, an internal, I'm going to act like I'm the auditor, I'm coming in. What do you have to show me? What have what should I not be wanting to see that is potentially still there? And doing walkthrough inspections with them, and taking the questions that you guys ask on the interviews and doing a little bit of a trial run with them and getting them ready for that. And then, when it comes to organization-wide compliance culture, I have an open forum that I've set up every month. I have a slot of time anyone can sign on and ask questions or review different things that might be coming up based on their campaign and whatnot. And then the main focus is really the workstation tracker audits. We had ours set up every single week. We're now switching it to bi-weekly, and we've created an in-house uh, automated tracker based on our map. And the supervisor will be able to go in and click on the seat, matching the seat number, matching the employee badge, matching all the data that's collected, and then, putting in all the different requirements for the workstation, paperless environment, password protection, so on and so forth. And then that whole structure, I can monitor as a director on the back end and then meet with the division managers and the executives to go over concerns that we may have leading up to Q4. And so this project started last year and it's now completed and ready to launch as of March. And so we're excited because it's all back-end automated versus spreadsheets the way that it was originally when we started on with Medcurity. And it's all through Google Suites. We have a little guru in our organization that's really high with involvement with Google Suites, and it's exciting because I always tell the staff, like, we're very blessed to have found Medcurity and the partnership that we have, because what we've learned along the way in our partnership is so rewarding and invaluable to what you pay for. There's a lot of human connection. There's a lot of, partnership that's gone into it to be successful in what we do. And so that way, now at this point, they know what compliance really is in the organization. And I think I don't even have to be on site. I was away from the site since August of this last year. And our assessment went through, and we were low risk, and we had really no issues that we were concerned with, because I built that foundation from 2024 as a consultant and coming in now. So it's been a great experience, working with Medcurity, and I recommend it, and I will continue to recommend it to all future clients and organizations that come across my path.
Thank you. That's really nice of you to say. And it must be so rewarding, just seeing everything come together and however, the process improvement. And I'm sure that the clients, the reactions probably so nice to see too.
Definitely. I've been in touch with Joe on your guys' team to kind of give him a rundown of the basics of what's occurred. And it's really nice to be able to see that, because I don't think we'd be where we are today without Medcurity. And you guys are just amazing. And so I can't say enough good things, because I've had different companies that we've worked with in the past, and it's just a different relationship and partnership than it has been with you guys.
Yeah, the collaboration and the relationships, like you said, is so important, and it makes just a huge difference in general, just the success that working together, like you said earlier, that you have, like, hold hands and you're in it together rather than the siloed environment. Like, how do you keep up with all the changes, like the speed of change? Like, oh, there's a new security rule coming out, or there's a different EMR. Like, how do you what's your go-to like resources? Like, do you go on the HHS site? Is there like some publications that you go subscribe to, or blogs and things like that you love, or what do you do?
I'm heavily active on my LinkedIn, and I follow all of the C-suite level staff of most of the organizations, and I really watch what they say and where they're attending. And it's been new for me in this past year to have availability to be able to go out and get my networking, the way that I want it to be, because this organization really takes up a lot of my time out in Mexico and virtually here in California. But the goal really on the consulting side of what I do, I intend to really go out and get more involved with the healthcare executives of America, and just, a lot of the platforms that I started with and studied in my degree, and my professors would always tell me, you need to be involved with HIMSS, you need to be involved with a lot of the governing organizations in the country in order to keep up with where we're headed. And that's one thing I really love about Medcurity is that you guys are very, very active and aware in the culture of what healthcare is. And so it's nice to have, that alongside. And anytime we've always asked, you guys have told us the latest and greatest, and we've never really felt behind on anything. And so that's been nice on the HIPAA side of everything. And for me, the goal is to really be more actively involved and in LinkedIn specifically, and following and watching and learning. I joined some podcasts and I joined some training materials, and I get the recordings and I listen to it if I can't during my schedule. Because a lot of the things that go on are during work hours, obviously, and then
Yeah.
you have to travel. And so there's a lot of that as well. So just finding time to get involved is really the goal for 2026, more than ever. But I would definitely say LinkedIn, and then National University is where I graduated from. I'm a double alumni there, and a lot of my professors are really heavy, and they do speaking and podcasts, and they're professors with a lot of different schools, and so I watch their profiles and whatnot as well. So I learn a lot in that aspect, in that platform too.
What about you, Margaret? Where are your go-tos?
Yeah, so when it comes to really what I keep an eye out on, it's always going to be cybersecurity and HIPAA focused. I always kind of tend to watch out for upcoming breaches, any issues with AI. I just feel like when it comes to AI, and I know we talked about this a little bit earlier, but just the monitoring tools and the safeguards that they're just not up to par with how fast AI is progressing, and how much is being utilized. And so I feel like that is a big area that I'm very curious about. And so a lot of cybersecurity is what I'm looking at, a lot of AI and the implications of how it can impact HIPAA and our clients going forward. So that's a big one. It takes up a lot of my time.
The LinkedIn, like I've noticed, like depending on who you follow, like there's a lot of great information. If you follow somebody who's privacy expert, maybe there's a privacy lawyer, or some of the even some of the regulators are on there. I follow CISA, HHS, and just their information pops up in my feed. And uh, the CISA website, actually, I was digging in there the other day, and they have a ton of resources that I downloaded, and it's easy to go down a rabbit hole. But it's all good information. Well,
Yeah.
I guess we're getting close on time. Any like last thoughts or things that you kind of want people to leave with?
I think my message to everyone is to really truly, have a compliance culture in your organization that is is active, is alive, and really make the staff value what compliance is and to not fear it. Having Medcurity as a partner is definitely something that is an asset and a benefit to your organization, alongside the team that they have with all of the tools that they give you and the resources that they give you to be very successful in your ability to mitigate risk as much as possible and to be safe, continuously 365, 24/7. I definitely am, a testimony of that because I've gone through it now 3 times with Medcurity, and really, really proud of where I am today with the organization and the partnership that we have. I highly recommend reaching out to Mel and some of the other individuals on the team to get any advice and or partnership, inquiries that you might have, to sit and talk about what the options are, because they are very flexible, they're very knowledgeable, and really your true partner in security risk assessments and cybersecurity, as an entity. So I thank you for having me online today, and I look forward to future podcasts and partnership.
Thank you so much, Naseem, and we appreciate you. And it's so great partnering with you, and really appreciate it. And what about you, Margaret? Last closing thought?
Absolutely. So when it comes to compliance, it's really not just to check the box once a year. Medcurity is there to help prevent catastrophic either cybersecurity breaches or any type of unfortunate events that might happen, whether it be a security incident or a HIPAA related incident. That is why compliance needs to happen year round. It's not just a check in once a year. We're checking the box, we do our spreadsheet, we're good to go because we kind of have to. That's not it at all. It's really taking a peek in every single part of your organization to make sure things are on the up and up. And if there's things that we can tackle and be proactive, not reactive, that's what we want to do. And we want to help each and every one of our clients to avoid any type of breach, any type of cybersecurity incident going forward. And that's how you do it, is being compliant year round and making sure everybody is on the same page within the organization.
Thanks everyone for tuning into this episode of the Medcurity podcast. And thanks Naseem and Margaret for being our guests today. If you like the channel, please don't forget to follow it and leave us a comment and let us know what you'd like to hear about next. Thank you, and we'll see you soon.